Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. For many years I've followed the studies on people with different autoimmune diseases like rheumatoid arthritis and ankylosing spondylitis and lupus. These are inflammatory conditions that are autoimmune in nature that can do a lot of joint destruction and cause a lot of pain and swelling and really compromise people's quality of life. And what's really apparent is that there are certain dietary, lifestyle, even supplementation practices that can help to tone down the inflammatory response and preserve some of the joint cartilage. And a lot of these things are not really discussed in sort of traditional channels. So I was really delighted to see this research review paper that I'm citing today that was published in the journal Frontiers in Nutrition. It was published on November the 8th, 2017. So it really is a fabulous review. And the researchers have some concluding recommendations as the research addresses the role of dietary practices in the management of rheumatoid arthritis. So they looked at all the research from around the world that's been gathered over the years and published in the different journals, and they wrote this fabulous review article on how patients with rheumatoid arthritis should be managing themselves using some self-care practices and the kinds of outcomes that we've seen. But these recommendations also extend to people with other autoimmune diseases, in my view, lupus and ankylosing spondylitis, as well as patients with just standard osteoarthritis or degenerative arthritis to suppress inflammatory response. So the researchers review the different dietary approaches that have been used over the years to help manage rheumatoid arthritis, and they cite some very impressive outcomes. So first up is this kind of drastic approach. Now, I'm not saying everyone needs to try this, but if you have a severe form of rheumatoid arthritis, you might want to do this with your physician. But it's called a 7-day supervised fast. So you fast essentially for 7 days. You have water and a few electrolytes. And it's followed by an ongoing vegan diet. So after the fast is over, you stay on a vegan diet, so no animal products whatsoever. And the patient's allowed to have limited vitamin and mineral supplementation and a bit of carbohydrate and energy in the form of vegetable juice for the 7-day period. So it's a limited amount of calories over that first 7 days. It's not a complete fast. You get vitamin, mineral supplementation and some vegetable juice. But it does lower your blood sugar tremendously. Now, the results show that this approach decreases the activation of what are called the CD4 cells. So in rheumatoid arthritis, in your immune system, there are these CD4 immune cells. And in rheumatoid arthritis and many other forms of autoimmune disease, the CD4 cells get activated and they morph into Th1 and Th17 cells, which produce much of the inflammation that occurs and promotes a lot of the joint destruction in rheumatoid arthritis. So this sort of 7-day fasting with a little bit of juice and vitamin supplementation has been shown to tone down the effects of the CD4 cell and also reduce the inflammatory response of other immune cells like the neutrophils, which often oversecrete an inflammatory compound called leukotriene B4. So just so you understand, when they give patients drugs for rheumatoid arthritis, they're trying to suppress the effects of these very same inflammatory mediators that I'm talking about here. So this nutritional approach has been shown to tame it in a very natural way. And as your blood sugar gets lower during those 7 days, you go into what's called ketosis. And one of the ketone bodies, which is called beta-hydroxybutyric acid, has also been shown to decrease the secretion of various powerful inflammatory chemicals or cytokines that are commonly seen in rheumatoid arthritis. So there seems to be this sort of multifaceted anti-inflammatory effect that's induced by this 7-day fast with a little bit of vegetable juice, vitamin and mineral supplementation, very low levels of carbohydrates just to sustain brain energy, but putting your body primarily into ketosis. There's convincing evidence that this form of medically supervised 7-day fast, you can't do this on your own, followed by a vegan style diet, can reduce inflammation, pain, and joint destruction in rheumatoid arthritis. That's the conclusion. Now, it seems a bit drastic, so there's other dietary practices that have been tried that seem to be effective. One of them is adhering to the Mediterranean diet. So this diet is rich in oleic acid, a type of essential fatty acid, as well as omega-3 fats, unrefined carbohydrates, and also some phytochemicals. So it involves high consumption of extra virgin olive oil, cereals, fruits, vegetables, fish, legumes, and very little red meat, and the inclusion of a little bit of red wine in the diet. Now, the olive oil and fish components are shown to exert anti-inflammatory effects, and studies show that people eating this way are much less prone to developing rheumatoid arthritis in the first place. So when you're having a diet that has a lot of deep fried foods, a lot of high-fat animal foods, meat and pork and cheese and high-fat dairy products and trans fats, these types of diets are linked to more, not just autoimmune disease, but many other degenerative diseases as well. So then there's this more drastic thing called the elemental diet. Now, this diet consists mostly of a liquid formula drink that has specific amino acids, a low amount of glucose, some vitamins, and trace minerals. So it's quite restrictive. You're trying to decrease certain stimulating factors in the diet, but a large study showed that 72% of patients on the elemental diet had more than a 20% improvement in pain and early morning stiffness. These are common things. So the formula is described as hypoallergenic to help tone down any immune system overactivity. That's how the elemental diet works. And then there's the elimination diet. So this diet attempts to eliminate foods to which an individual may be sensitive, because studies show that with rheumatoid arthritis, some food-based antigens leak across the gut into the bloodstream, and they produce these inflammatory responses, these immune inflammatory responses that exacerbate rheumatoid arthritis. Now, after reviewing all the available data, here's what the researchers suggest rheumatoid arthritis patients should do to help reduce their symptoms and disease progression using just common daily dietary practices. In fact, this is a quote from the researchers. "We believe that an ideal meal can include raw or moderately cooked vegetables, lots of greens, lots of green leafy vegetables, and legumes, beans and peas, and including, by the way, soybeans and soy products. With the addition of spices like turmeric. Turmeric contains curcumin, which is a powerful anti-inflammatory, and ginger. Ginger contains gingerols, which reduce inflammation, and seasonal fruits, probiotic yogurt to improve the gut microflora, all of which are good sources of natural antioxidants and deliver anti-inflammatory effects. The patient should also avoid processed foods, high salt, oils, butter, sugar, and animal products, like meat and cheese, and so on. Dietary supplements like vitamin D, cod liver oil, and multiple vitamins can also help in managing rheumatoid arthritis based on the available evidence. This diet therapy with low-impact aerobic exercise can be used for a better degree of self-management of rheumatoid arthritis patients with minimal financial burden." End of quote. So they go on to cite studies showing anti-inflammatory effects of green tea catechins. So drinking more green tea, it contains these epigallocatechin gallate polyphenols, as they're called, that reduce inflammation and decrease free radical damage. And the use of ginger and curcumin and boswellia, another anti-inflammatory herb, and ashwagandha and cinnamon bark. They cite evidence for all of these sort of spices and herbal agents. And they talk about the anti-inflammatory properties of certain fruits and vegetables like grapes and oranges and apples and tomatoes and spinach and potatoes, which contain p-coumaric acid, which is an anti-inflammatory. And the anti-inflammatory properties of soybeans, which contain the isoflavone genistein. And the anti-inflammatory properties of omega-3 fats, as well as borage seed oil, which contains gamma-linolenic acid. I personally take a supplement each day that has fish oil, borage seed oil, and flaxseed oil all in one capsule. The anti-inflammatory and antioxidant effects of prebiotics and probiotics, they also discuss this, helping to improve the gut microflora and immune system modulation. So in my view, this dietary approach is not only good for patients with rheumatoid arthritis, it's also a great approach to prevent and help manage many various degenerative diseases, from heart disease to Alzheimer's disease. This is a very health-promoting diet. So the review paper is a very worthwhile read in its entirety for those diagnosed with rheumatoid arthritis, any autoimmune disease, or osteoarthritis. So I've included a link to the complete text article in the text below. So thanks for watching, and I'll see you next time.